So what we've gained from this wave of sleep research is that a good night's sleep plays an essential role in maintaining our mental health. And so we understand that many of the brain chemicals which are responsible for managing and controlling sleep are also the ones which are responsible for managing our mental health. And so when one is upset, the other is upset. And most of us know exactly what this feels like, because after a poor night's sleep, many of us will feel our mood is lower. Hence the phrase, looks like he or she got out of bed the wrong side this morning. So, and it's important to stress that that will impact our everyday lives. So we wake up and we are in a bit more of a mood with our partners, with our children. We then sort of commute and they will feel the effect of that. So it can impact our daily lives. But what we also know is that if you are consistently experiencing poor sleep in a chronic manner, then that can increase our risk of more severe mental health issues such as generalized anxiety disorder and depression. Most of us will have experience of how a poor night's sleep can impact our daytime performance, how we go about being in the office, for example. And what we know from sleep research is that poor sleep impacts an area of the brain known as your prefrontal cortex, which is responsible for a lot of those higher order functions. So we see a deterioration in our ability to be focused and attentive, to recall memory, to problem solve, to be creative. But what we also see is that we get pushed much more into our amygdala, this primitive threat detecting part of our brain, which means that we struggle more to manage our mood. Our outlook on the world, on others and towards ourselves becomes much more negative. What we now know from sleep research is there is an intimate relationship between how well you sleep and your ability to manage your weight. And this is specifically because sleep plays a role in managing two hormones called leptin and ghrelin, which regulate your sense of satiety and your appetite. And what we see is that when we experience poor sleep, we feel more hungry and we don't know when to eat. So it sort of creates the perfect recipe, so to speak, for causing us to overeat. And what we know is it increases our risk of obesity.